Okay, as a continuation of what we were discussing, we want to continue to discuss units and pivots and why they're so important. We got into coupling, we discussed coupling, how important that is. Also how it neurologically is so important because we're getting the pressure off of the nerves, but also particularly the spinal cord and brainstem, how important that is. But also I want to discuss units and pivots, and that a unit is to function as a unit, and therefore we have to have it anatomically that way so that it can do that job. And most of the spine is not. By the time it gets to us, when they're in so much pain, it's all over the place. There are all kinds of problems with it, and we've got to get it anatomically so that the three tissues, which we'll discuss later, the three different tissues that we're trying to change, so that we can get those to change. The soft tissues can change so that we'll have an anatomical structure that can do that unit pivot thing. Why is pivot so important? Well, just like C5. C5 is the thickest vertebra bone-wise. It's the smallest hole for the spinal cord, and yet it's got the biggest part of the thickest part of the spinal cord. Sounds like God made a mistake. Well, He didn't. It's perfectly the way it should be. But it's not meant to operate like a regular vertebra. It's not meant to laterally flex, extend. It's meant to be a pivot. So that makes it so that we have a very large margin for error. And it's meant to be in a position to where it doesn't have stress on the discs, so that we don't cram those discs down and wind up with all the pressure over the disc, and we have this huge disc bulge and then therefore herniation. It's meant to have a curved system, and when we lose the curved system, we begin to beat the discs up, and we have a problem. So our job is to restore that structure. Now,
how does that relate to me as far as like doing the exercises and everything?
Okay, it relates to how we shoot the x-rays. It relates to how we mark the x-rays. It relates to how we set up the weighting system on the patient. It relates to how we set up their molding, where we're going to put their molding. It relates to how we do the fulcrum exercises and therefore the link trainer exercises, which are all a part of rehabilitating those three soft tissues, which are the white tissue, the red tissue, the type 1 postural muscle fibers, and the neural tissue, which is the brain stem and the alpha-2 nervous system, to function this entire system. So literally everything that we do, even down to how we mark the x-rays, is because the x-rays are our blueprint to tell us how are we going to set up their molding and their weights and their fulcrum exercises and everything else. That makes some sense?
Mm-hmm.
So knowing the basic normal model is vital for understanding how are we going to care for the patient so that we can change the structure so that eventually they can take care of themselves without us. Go ahead and turn it off.
Why is it important that your assistant knows everything you know?
Well, that's how I train everybody. I train the patient to know everything that we know. We have the smartest patients in the world here. But also I want my assistant to be able to think on their feet, and also when I'm looking, I want another fresh pair of eyes. When I'm looking at x-rays, when we're talking, I want to be able to throw concepts and theories. Ultimately, I make the decisions, and I do. And they rest with me. But I always like my assistant to be able to think, to see, to understand with clarity what's going on, and then by that being a fresh pair of eyes. It's almost like a nice little second opinion. That's how I've come up with a lot of new ideas and new ways of doing things here, is to have other people who understand it very well so that we can discuss things, and then I come up with ideas with things that are said. So